Congratulations, you just got hired or thinking about trying oncology nursing. In this video, we will talk about general things like what to expect, what to do, how to prepare yourself as an oncology nurse. Not all oncology floors are the same, but in general, you should know the most used terminology. It will help you figure out your plan of care for that particular patient. For example, if a nurse comes to me and gives me a report like, this is a 70-year-old male with diagnosis of AML, status post, bone biopsy 2 weeks ago. He just completed cycle 1 of chemotherapy. Today is day 20. He will start his cycle 2, day 1 of chemo. It will first sound foreign to you, and that's okay. We are not born as oncology nurses, we learn. You can write down as much, then after you can always look it up. Come in with compassion and empathy. I have to say, you will not connect with everyone. There will be certain times where you just want to do your job as a nurse and provide the care that the patient needs. And that's okay, it's normal. However, there will be plenty of times that you will get to know your patient's family. Some treatments require patients to stay in the hospital while receiving chemotherapy, radiation, and other treatment options. Unfortunately, for some, you will see them often because they are very ill, and eventually, most of the time, you will be taking care of the patient and providing comfort measures until their last breath. Be prepared to shed some tears. Don't be afraid to advocate for your patient and your patient's family member. I have to say, as an oncology nurse, you will be accessing central lines compared to other fields of nursing. By 6 months, or probably less, your skills with accessing a central line, de-accessing, dressing changes will be on point because it will be like second nature to you. Examples of central lines are Portacath, Picklines, IJs, subclavian lines, femoral lines, and many more. That being said, I have to say, one of my pet peeves is IV tubing, IV access, IV central line access care. I don't like it when nurses leave IV tubings uncapped, or when they use the white cap from the flush to cap the end of the IV tubing, leaving the central line dressing halfway hanging, no tubing dates, and many more. In general, you can technically leave the end of the IV access uncapped. It's not the best practice, so try not to do that. And if you, as the nurse trying to access it, you are supposed to wipe it vigorously with an alcohol wipe before you access. Also, with IV and central line dressing, if it's halfway and done, just change it or reinforce it until you have the time to change it. Or, since nursing is 24 hours, you can let the next nurse know that you didn't have the time to do it. Your patient is very sick, their white count is probably low, they're neutropenic, can't fight all of this infection. You as the nurse should be conscious about this. Be familiar with the routine plan of care. For example, I work in a hemonc medical floor. If I was given a report about sickle cell anemia patient who's having a sickle cell crisis, I immediately would think of H&H, normally PCA for pain management, fluids, O2 saturation, coagulation medication, and many more. As you work, you will recognize more and more of these are just standard practices. It's important because some doctors can forget, maybe they are just rotating or they are new to oncology, or for whatever reason, you will be able to advocate for your patient. Consents. Please make sure you know your facility's proper protocol for administering any test or medications. I know this is like nursing 101, even though they are computers and other humans like doctors, pharmacists, etc. that should put a hard stop on some tests or medications. Sometimes it can bypass that personnel, and eventually you will be the last human to potentially can put a stop to it before it causes patient harm. As an oncology nurse, you will be giving platelets, albumin, red blood cell, and repleting electrolytes most of the time, and of course, co-signing with your coworkers. So the best practice is always to make sure you are following your facility's protocol. Make sure there is consent and the blood products you are co-signing for and or administering are compatible. Just because your coworkers say the consent is in the chart or they received blood yesterday doesn't mean they really did. If you are not sure what to do or unclear, always clarify. I have to say, even though you are a seasoned nurse, but you are new to a certain specialty or a unit, you sometimes can feel anxious and you feel like you just don't know most of the stuff that is going on. That is normal. Not all nursing fields are the same. Don't worry about what they think of your questions. Some nurses sometimes forget how it's like to be new to a place or new to nursing or new to the specialty. Don't pay them any mind. As long as you are asking questions and you are practicing safely, you will be fine and eventually find your beat. And soon enough, you will be confident. I have my oncology nursing workflow video. The link is in the description or on the top of the screen. Question for you. Tell me why you are interested in oncology nursing. Comment below so we can share our experiences together and share with everyone who is also interested. If you like this video, please consider hitting the like button. And if you want more videos like this, please consider hitting the subscribe button. Thank you so much for watching. I'll see you guys in the next video. Paalam!